Okay, so I'm going to be doing the exam for the lung and thorax. So first I'm just going to observe, looking for any tracheal deviation, any obvious signs of bruising, scarring, lesions, abnormal moles, anything like that on the neck. Looking at the size of the chest, the symmetry of the shoulders, clavicles, seeing if there's any obvious changes. Then I'm going to just look at the patient's hands, just looking at the nail color, looking for any clubbing, any yellowing, any signs of like Raynaud's. Then I'm going to look at the respiration. So I'm going to take just like I would for a pulse position, and I'm just going to use the clock, and I'm going to watch for 15 seconds, pretending I'm taking pulse, but I'm actually taking respiration. And then you just multiply it by 4, so hers was 4 times 4 is 16, so that would be within normal limits because normal is 12 to 20. Then I'm going to do chest expansion. So I'm just going to tell the patient I'm going to put my hand across the front of your chest, just like that.
Sorry.
And then, no, you're good. And then one hand on the back, and I'll just have you take a nice deep breath in, and I'm just feeling for the movement of your chest. And then I'll do the same thing from the side. So I'm going to put my hands on T7 on both sides of the rib heads, and my fingers will be in the intercostal spaces. I'll have you take a nice deep breath in, and they should separate, and then out, and they should come back together. Then I'm going to do tactile thermitis. So I'm going to place my hands in 4 spots on your back. At each of the spots, I'm just going to have you say 99, feeling for any differences in vibration.
99, 99, 99, 99.
Okay. Then I'm going to do percussion. I'm going to be using 2 fingers in the intercostal space, tapping them hard enough to hear for any differences in resonance from side to side. Doing it like a ladder. All the way down to T12. Then I'm going to do lung sounds. So first starting on the back. So I'll just have you breathe a little more deeply than normal. Okay, listening for any obvious changes between the 2 sides. You're doing 4 spots straight down, 4 on the left, 4 on the right. Then for the lateral, I'll just have you bring your arm up like this. Breath in. Then on the left. That one listening for 3 on each side for the superior, middle, and inferior lobes. Then on the front, I'm going to use the bell for right above the clavicle. Sorry. And then switch back to the diaphragm. Just listening for any changes from side to side. They all sounded equal. Then I'm going to do the testing. So you would only do this if you found any differences from side to side, and you would only need to do one of them, but we're going to do all three of them. So the first one, I'm just going to have you say, what is it again?
Scooby-Doo.
Huh?
Scooby-Doo.
Scooby-Doo. So I'm just going to have you say Scooby-Doo, and I'm just going to listen to the same 4 spots in the back as I did with the initial screening.
Scooby-Doo. 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 Scooby-Doo.
And then the second test, I'm going to have you say E, and the difference would be it sounds like an A on the affected side.
E. 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 E.
And then last, I'll have you whisper Blue Moon. Okay. And that is it for the lung exam.